Hey guys, welcome back to the fitness experiment. We're going to work on having a lot more guests here in the near future. Want you guys to be able to get exposed to as much information as possible from all around the world. So this week, we have a good friend of mine, Dr. CJ DePalma from Pensacola, Florida. CJ is the movement doctor. He is working with everyday people all the way up to CrossFit Games champions, manage their pain and their rehab. So he has an integrity standard that is above and beyond anything really that I've come across in this space. We've had some great PTs on in the past that also had the same opinions on some things as CJ. CJ brings a really cool perspective to everything. He has a cool story about where he started, where he's at now, where he wants to go in the future, and just really putting his patients first by listening to what they are saying and then helping them understand the why as they go through their recovery process, whatever that is for him. Before we get into this week's episode, we're going to announce the winners of our Thrive 1.0 giveaway. We have 5 people that have gone through and entered themselves into our draw on Instagram. Appreciate all you guys doing that. Even if you don't win, just stay tuned. We're going to be doing more of this stuff. Just really appreciate you guys listening, caring about what we have to say, and staying involved in what we're doing and taking an interest and trust in what we're trying to create here.
Yeah, you guys are going to dig this episode for sure. And like Jesse said, we're going to do a lot more of this in 2020, have more people on like CJ who can bring their knowledge, expertise, experiences from legit all around the world. We have some other cool guests planned for you guys. And after all, the name of the podcast is The Fitness Experiment. So we're going to get to hear about all different types of, if you will, fitness experiments so that you guys can learn and apply different tactics, tools from everybody and really just improve how you feel on a daily basis. And like Jesse said, we really appreciate everyone who express their interest in Thrive 1.0. We put a lot of time and effort into this. We really think it is unique and just different from all the other programs out there, both from a nutrition standpoint and from a fitness and workout standpoint. And this is really just the step one of this.
Yeah, so we got our 5 winners here. We're going to send you guys DMs and get you sorted out, but wanted to give you a little shout out on the air here. So Nicole Mantle, I'm just reading the Instagram handles also. So if you have a weird Instagram handle, this is just what happens. This is the consequences of your choices. Nicole Mantle, Ali Holvo, Sparkly One, Tim Vincent, and Kembella. We'll reach out to you guys individually via Instagram and let you guys know what the next steps are to claim your prize. Enjoy the episode. Okay, we're here with Dr. CJ DePalma, the movement doctor. If you're on the social medias, that's where you can find this guy. I got to know CJ through WODPrep. Kind of working together, answering some coaching questions in Facebook groups and working on programming and things like that. I want CJ to tell his story for us because he has a very unique story about his philosophy around what he does. So I'm just going to pass it to CJ so that he can explain to us what his approach is and what rethink your rehab means to him.
Sure. That's a big question.
I love it.
So, I guess we'll kind of like backtrack to like school and pre-PT school and things like that. So the movement doctor kind of came to me while I was in school. I was at CrossFit Soul, which is a pretty well-known performance gym in Miami. It's where I was at school, and I was training with them. I was training next to them. I wouldn't say with them. It was more like osmosis of me like following like the little turtle behind. So, but I was like bartering for a membership. I'd work on some of the athletes there and things like that. And I got to train around a lot of really big names. Like I was super early into CrossFit, like 2 years in, and I'm training next to people like, I don't know, Sam Briggs and, Team Soul in 2015, went to the games that year and did really well. And so, I was training next to people that were exceptionally better than me. So I fell in love with like the concept of treating athletes, and I was doing a lot of hands-on work then. Right. And, cause at that time I wasn't, I guess qualified enough to like adjust their programming, which is kind of like where I've kind of fell into now. So anywho, I was like the movement PT then. I was trying to find a name, and then the movement doctor just kind of came, then used your thing. And I got a lot of backlash for it. I was like, it's tacky, it's lame. And I was like, well, it is what it is. And the logo, it was like, the logo's too aggressive. You're a physical therapist. And I'm like, well, I treat athletes, right? And that's just kind of how it was. And then I ended up going through phases since the business started of I wasn't treating any athletes. So it's very interesting. But anyway, so finished school. I worked in a traditional clinic for 3 weeks, and I quit. And I didn't even work full time. I was working like 4-hour days, and I was in South Orlando, which is a very heavy Puerto Rican population, highly predominantly Spanish speaking demographic. And I don't know if you can tell, but I don't speak a lot of Spanish. Even living in Miami, it just was not a thing. So I was very upset with just the situation, and the thought of opening the clinic had been something that I've wanted to do for a long time. And the August prior to that, this is August of 2016, my buddies at Mako CrossFit, we were at a bachelor party and we were drinking, having a good time. And they knew that I wanted to open up my own thing. And they were just like, hey, we want you to come up here and open it. I was from Pensacola. It's where I went to undergrad. It's where I met my wife. My wife's from here. One of the owners' wives and my wife were best friends. And so it was just like, let's do it. And one day in November, after I passed boards and started working for this mill clinic, it was like a Sunday, and I was like, I don't think I'm going in tomorrow. So I called them like 7 a.m. on Monday, like 10 minutes before my shift was supposed to start. I was like, I'm not coming in. They go, are you serious? I'm like, yeah, I'm sorry. I'm like, yeah, I'm not going to come in. Like, you're really hurting us bad. I'm like, I'm sorry. I don't know what else to tell you. So that's kind of like where the move, and then we just kind of figured it out. I had no idea how to run a business. I had no idea what I was going to do and all of this. And I had no money, and we just kind of figured it out. They gave me a really good opportunity, and I was able to kind of create the movement doctor of this like single person, private pay, PT clinic. And so when I started, my initial, motto was basically, changing the views of through movement, posture, and rehab, right? So this concept of like perfect movement and perfect posture. And that was like my initial thing. And it's so funny because if you look at my social media, you couldn't see anyone more anti-posture and anti-perfect movement from a pain and rehab perspective. And that transition happened over time. I used my what I learned at CrossFit Soul from like training athletes and training with athletes and actually seeing what high level training looks like was probably what I've taken the most and like kind of helped me as an athlete myself, and what's opened up the doors, I guess, to like really work with CrossFitters primarily. So I can never thank them enough for it. But when I started in this transition, I wanted to train athletes. That's all I wanted to do. And Pensacola is a really small town, and I didn't need a lot. My overhead was really low. And so I started doing like mobility seminars, right? Tagline word, right? And buzzword. Mm-hmm. And then all these things. And I was part of the clinical athlete, right? I don't know if you guys know Quinn Hennick and Juggernaut Training Systems. Quinn's the PT there. Yeah. So he started, him and a chiropractor and another PT started Clinical Athlete, which is basically like a clinician forum for people who are athletes. And in there, we were in the forum one day and I was talking about my mobility seminar, and I got blasted with the things that I was claiming that we were doing and changing. And I legit almost quit the profession. It was like a month of me just like sitting on my thumb and just being sad. And like I was like emotional, and I was like, this sucks. And I was like, and it's just crazy how much you realize you don't know when you get out of school. School teaches you one thing and you get out and you're like, okay, here's all the evidence that just shows everything you just learned for the past 3 years and your 6 figures of education you just spent is disproven. Then why do people get better? Why does it work? Because everyone just gets better. We can talk about that kind of later.
Yeah, I'm excited about that one.
And so it was like this transition over time, right? Like starting as someone who did a lot of hands-on work, worrying about like perfect movement, bad movement would cause a lot of pain, et cetera, et cetera. And it just kind of transitioned to this, what we call pain science, and this pain neuromodulation of like how there's hundreds and hundreds of factors that affect pain that aren't structurally driven or movement driven. Their beliefs and social influences and psychological states, depression, hormonal changes, nutrition, sleep, what your mom said, whatever, right? And so we've kind of transitioned into basically being more of a rehab coach and just educating people. I'm not saying that, you pulled a muscle in your thigh and it only hurts because you think it hurts, or it doesn't hurt because you don't think it hurts. It's just much more complex than that. We've learned that pain is super, super complex, and there's so many more things that are going in besides. I had a patient come in yesterday, and she came in and she was concerned about quitting CrossFit. She had just started like within the last couple of years, and she was really worried because she can't get over knee pain. Keeps coming back. And all the things she told me, she was like, I was in a car wreck 8 years ago. Okay. I have bad knees. I'm like, okay. And I have flat feet and I stretch all the time. And then I'm like, well, then what's wrong? And she's obviously, she's super mobile, as most females are. Mm-hmm. They can reach all the positions without issues. And she's like, I have flat feet and I have this and my knees cave in and I have a tight IT band. And I was just like, what good have you ever seen when you walked into a clinic? They told you what you do really well. And she was like, well, no. And I'm like, let's talk about that. Let's talk about the good and the positive, and let's create a plan that doesn't worry about the structural abnormalities or the structural not perfections that you have. And let's look at, what we can adjust, which is training volume and load progression and belief patterns, right? And like all of these things. So that's kind of where the practice has gone, is coaching people, not coaching them to get better, but to make better decisions, right? People just get better, right? We have a lot of good research that shows that we can't really influence pain super well from a long-term standpoint. Everyone gets better. Everyone feels better in the short term. That's why the Theragun works. That's why the Normatec works. That's why the crossballs work. That's why sleeping is better, because any input whatsoever in the short term creates change, and it's all perception driven, right? Cool. So I didn't quite answer the question all the way, but I feel like we'll kind of answer a lot of it as we continue to talk.
Yeah, that's great. I think the biggest thing I think for the two of us, if we're talking about just coaching CrossFit group classes, a pretty standard situation that's going to come up is somebody's going to come up to us at the end of class and say, hey, Jesse, I have this pain in my elbow. What stretches should I do to make my elbow feel better? Like that's the dialogue. But we know that pain doesn't always equal injury. And
right.
So what would be your approach? Like if somebody were to come up to you and say, hey, CJ, I got this elbow pain. What stretches should I do? What would be your answer to that question?
Yeah. So my next thing is always a question, right? It's like, how long has it been here? Like it just started today. I'm like, okay, it'll be gone tomorrow. Like we don't, right? Started a week ago. Okay. What were you doing? Perfect example. I have a patient. I saw a patient yesterday, 2 weeks into some like lateral tendonitis, right? Pain, tender to touch, pain with wrist extension, pain with rotation, pronation, supination of the forearm. And the Mako program has had a ton of dumbbell work lately. Okay. So, right.
Yeah.
Lots of dumbbell hang cleans, renegade rows, dumbbell snatches, devil presses, just like prioritizing the dumbbell goes through phases. Right. So I was like, all right, well, let's put down the dumbbell for a little bit and let's work on the barbell. But my answer to that is usually find a history, right? You gotta find what's going on, what hurts, where does it hurt, what's causing it more pain, right? And from a coaching point, finding out like, okay, what hurts, what makes it worse? Okay, well, snatches. Okay, well, since when? It's Wednesday and since Monday. Okay, well, it's probably if we just, either back off load or like our aggravating factors for a very short amount of time, then usually it just gets better, right? It just does, right? And unfortunately, you said elbow, which is probably like one of the worst ones to say it just gets better, because we have a lot of good research that shows like elbow tendinopathy can last from like 12 to 18 months. It's just like very frustrating. Right. Main reason why is because everything we do, we have to grip really hard, right? Mm-hmm. So as far as like a stretch, usually it's not a range of motion thing. Tendinopathy or whatever, elbow pain is usually not due to lack of mobility. Like you just wouldn't be able to reach the position if it was, right? It wouldn't be like my shoulders hurt because mobility overhead sucks. And it's like, well, it maybe, but it's probably just because you're not used to being overhead, right? We look at tolerance, right? We look at pain more so as instead of weak or short or imbalanced or fucking inhibited or whatever awesome term that Kelly Starrett has fucking created, like whole CrossFit believes it's probably more so just you're not tolerating the shit you're doing, right? That's it. You either do too much too soon or you don't do enough for too long. And we either basically reduce our tolerance because we're pissed off because we're doing too much, or we have no tolerance because we're too deconditioned, right? And that's not an in-shape thing. It just means that could be strength, could be pure conditioning. It could be anything, just tissue loading, whatever, right? So it is that simple, but again, pain is super complex. So that's why I try to avoid diving into the weeds of like trying to mechanically diagnose every single thing of pain. That sucks. It's super hard. And that's all school taught us. And everyone presents differently, right? It's important to understand, your structures and things like that. But especially as a coach, it's like, look at the aggravating factors and adjust those, right? Don't do any more than that as a coach.
Right. And there's a thing too, for the most part with sports teams that I coach, the coaches want me to add in stretching at the end of their session to help with injury prevention. And trying to explain to, a coach who's been involved in a specific sports space for a very long time that probably, and for sure, isn't going to prevent injury. Is there like a certain language that you would use with somebody to help get that point across? Or for our listeners, like how does stretching not prevent injury?
Yeah, well, so what does stretching do, right? The goal of stretching is to increase flexibility, right? That's the goal of stretching, right? And that's literally the goal of it. That's it. If you feel good doing it, then you should do it. That's the answer. But as far as what it's accomplishing from a performance standpoint, it is very rare for someone to stretch themselves into a better position. It's very unlikely because you still have to grab the barbell and put it over your head, right? And more often than not, I see people who can get overhead in a good position, but as soon as they start to squat or do anything that requires any type of contraction or stability, they crumple. And not because they're unstable. I don't like using those terms, right? It's because they just don't know. Their body's not used to it yet, right? So to answer the question of like, what does stretching do afterwards? It can make you perceptually feel less tight. Yes, for sure. But so can hitting the Theragun, so can taking a big deuce. Like you just feel better, right? Like, because these things, everything works in the short term. Eating a really good meal, right? Like it's just like, you just feel better, right? Endorphin responses. And so, but why? The question is always why, right? Why do we need to stretch afterwards? To prevent injuries. Well, based on what mechanical response? That you will be less likely to be injured if you are more flexible. That is not true at all. Now, the ability to accept load in bigger ranges of motion, especially from a sports team for athletes with directional change, yeah, that's important. Someone's like, oh, I started running and I pulled my hamstring. It's not because you weren't flexible enough. It's because you weren't fucking ready to run. Right. Like you just weren't ready. You either like you just took off on a dead sprint, And if you sprint all the time and you take off on a sprint, you're probably not going to pull anything. You're probably fine. But case in point, 20.1, hanging with a buddy. I bet I can beat you in a 200. And I was like, the fuck you can. So what did I do? I sprinted 60 yards in, pulled my hamstring. Not because I wasn't warm. I had just got done lifting.
Right,
but I haven't done a full out sprint in 8 months, right? It's not because my range of motion is terrible. I deadlift every day, right? Pull from the ground. So the amount of range of motion you need to accomplish movements is much lower than we believe, right? And so to answer the coach, right, especially from that's Duke.
Hey, Dukey, what's up, buddy?
It's hiding there.
It's to the question is like, what are we accomplishing, right? Is it just to perceptually feel a little bit better? Then sure, that's a good one. But as far as preventing injuries, because it helps increase flexibility or prevent tightness, no. If you're in activity, you do hockey or football or soccer or whatever, every day, then you have all that range. Because why? Because you're doing the movements all the time, right? You don't need to stretch on top of that. Is it cool to be able to do a straddle? For sure. Cool. If that's what you want to do, then do it, right? We have a lot of good knowledge that shows that if the more flexible we are, we usually aren't as great at producing force too. So we want to be careful with it's all about reasoning, right? Nothing is bad. There's nothing inherently bad, right? At all. But it's the reasoning. And that's where all of this practice has come from, is because our reasonings, what they taught us in school, what most people justify why they do things, is trash. And we've disproven it across the board, time and time again.
I think since we've, before we get too far away from our discussion of pain, I think now would be a good time to bring up the CBD. I wanted to ask you about this. So it's obviously super popular right now. I mean, you open up your Instagram any day of the week, one of the posts you see as you scroll down, it's going to be something about CBD, miracle cure this, that.
Oh my gosh.
We probably all have our own kind of thoughts about this. And I think that we're probably similar in what we think about this, but I think you're in a unique position, obviously, because like you just explained, you see a lot of people that are dealing with pain. CBD has something to do with pain. So I'm just curious from your perspective, like what has your experience been with seeing and treating clients? Like, does this come up a lot? Do they ask you questions about this? Or maybe it's not as popular as I think it is.
Sure. Yeah. Well, it's obviously we're not recreational in Florida. So, so that's number one. With that being stated, what you can get outside of your recreational states, it literally doesn't count at all. It's like taking a drop of sugar water. Okay. So unless source is very important. Why? Because of how much whatever it is that we're putting in there. I don't know a lot, but it's just from I know some people that sell in Colorado and California and their friends, and we've talked about it before. So where you're getting it is super, super important, especially when we're talking about if and how it's being effective. If you're getting it in states where recreational use is not legal, you are not getting at all of what the big claims of CBD are being used, right? That's number one, because it's going to be too low of a dose. It's not going to be strong enough to really do anything at all, right? Sure, you can get tired and sleepy. I mean, who doesn't? I mean, it's whatever. So, but I look at everything, every passive intervention, 100% the same way, is if your baseline is here and you can't reach your baseline without this thing, whether that's an intervention of hands-on therapy or massage or Theragun or certain food, even everything. If you are only getting to baseline with supplemental inputs, CBD oil, constant foam rolling, I can't do anything until I foam roll, right? So if this is your baseline and you only get here with all of these passive interventions, that is not a good thing. Supplementals should take you above, right? That's what they should do. They should take you to the next level if that's what you're looking at. So once we're dependent on anything, it doesn't matter. Besides active in your own personal self, this intrinsic concept, right? If we're prior to that, then I don't think it's beneficial. I don't care if it's the best CBD oil on the fucking planet.
Right.
I don't care if it's going to take you to Mars and back in a day.
Yeah.
You're solve space travel with it, right? And like time travel, it doesn't matter. If it's only taking you to baseline, it's not that beneficial for you. But from like an actual like mechanism of action, I don't have a lot of great information on it. I'm totally fine with people taking it subjectively, like when they're stop. I think someone just got home. So as far as like the chemical responses that are happening, I don't have a lot of great information on it. I will more once Florida is recreational for sure, because then I'll probably be more involved with it and see it more and things like that. So yeah, that's kind of where I'm at with anything, especially CBD oil.
You have the same opinion on the CrossFit gear?
That's unfortunate. Are you guys back?
Yeah, we're back.
Yep.
Cool. I lost you for a second.
We're good. You know how CrossFitters love their gear. Would the gear conversation fall under this same umbrella?
Yeah. 100%.
Like if you can't squat without knee sleeves, you should probably fix your shit.
Yeah. 100%. Like beyond tenfold. But I was that guy, and this is why. When I was down at Seoul, dude, is the person behind the screen that guy?
Yeah.
Is the person? Yeah.
Yeah. He's like, oh shit, I can't squat without my knee sleeves.
But I was that guy. I was like Olympic shoes, knee sleeves, and like the tightest RX gear wrist wraps you could see. My hands would turn purple. Like I can't do anything without my wrists being fused together. And then I couldn't figure out why my wrists hurt all the time when I did literally anything. I was like, oh yeah, I'm not letting it move.
Yeah.
So I was that guy. 2 hours of warm up, floss, foam roll, joint by joint approach, like very FMS, Gray Cook, like mobility, stability, boom, 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 systematic, and I was always in pain, and it sucked, and it was just so time wasting. So, anyways, but yeah, same thing.
Yeah, I think that's why you have a cool perspective too, like having been that guy already and like having gone through very formal education on this stuff and then kind of come out the other side with a whole new perspective. And then I think you also know that like as you go through this journey even further, your perspectives on some things are probably going to sway even more. Right? Like,
yeah, but I mean, it could sway back, right? I mean,
right.
You have to be like malleable to the situation, right? And transparent. So like I could a study could come out tomorrow say that dry needling is, literally the best thing ever. And we have physiological evidence that we're creating lots of improved tissue function and change, and we would swing for sure, but it doesn't and it hasn't. So that's where we're at.
Yeah.
I get how the money, if we're talking CrossFit athletes, I get how the money is not great in it and these athletes have to make money somehow. But if we're talking gear, we're talking CBD, we're talking the Theragun, the messages and the posts they put out there are literally what you just said. Like, oh, I can't do anything without my 3 drops of CBD before my warm up and my 12-inch thick knee sleeves. And then I also have to drive the Theragun into every joint of my body, and then I'm ready to go. This is my daily routine. And that's basically the message that they're putting out there.
Oh yeah. But I mean, that's just sales, right? And the funniest thing is like, who's Theragun's biggest athlete now? Right? Rich Froning, right? Yeah. And who's the guy that probably hasn't done a warm up in 10 years of CrossFit? Rich Froning. The guy just starts squatting and he's like, all right, I'm good. And now like you see it, I don't know, like the behind the scenes of mayhem or whatever, and he's just like, oh, I do 30 seconds here and 30 seconds there, and I'm like, no, you don't. I mean, you might not. You don't need to. Like, you have no need for that, right? Like, there's no need at all. You know. So, anyways, but yeah, that's what it is. Again, reasoning, right? I'm not saying that Theragun's bad. It feels fucking great. I love that shit.
Yeah.
But why, right? Outside of just feeling like it feels good. Is it physiologically changing anything? No, it's not.
Okay, that answered my question because I don't know anything about the Theragun. All I know is that it's like a jigsaw for your body.
Yeah.
I had no idea what it was supposed to do. I don't really use any of that stuff because I just don't get it.
Is it fit? Fancy?
Do you know what the actual, like, what's the whole premise behind it? Like, what would be the purpose, or what do they say the purpose is anyway?
So percussion therapy, right, initially was for increased recovery times, basically like massage, which we've shown that it doesn't really do a lot of. then it became this like warm-up thing. And we actually are starting to have some good evidence to come out that shows percussion therapy reduces the ability to MVC, max voluntary contract.
Right.
What? So this device that's supposed to warm you up is now reducing your ability to contract at maximal input or maximal output. Great. I'm super excited that you are giving all of these people this device that is showing through evidence that as soon as you use it, you have a window where you are now weaker.
Yeah.
Awesome.
Sweet.
Fucking great. Sweet.
Go try and max out your back squat though.
Right. So and it's just to feel good, right? People are like, it's like foam rolling. When the reason it came out was because foam rolling is a pain in the dick. And it was, right? You know, and then you had like K-Star came out with this like literally this like saber-toothed fucking tiger on a blue roller that thing, like would hurts.
Yeah, man, it'll rip your leg off. I sat on it once. I was like, fuck this thing. I'm not going back on this. Yeah. Dude,
I get a massage maybe, God, last one was like 2 years ago, and I had to stop because my quads, I'm just like, I mean, I'm not the most flexible by any means, right? And I wouldn't mind being more flexible. It doesn't affect anything I do, you know, but I wouldn't mind being a little more flexible. But I would get work done. I would barter with some people when I first started, and I legit had to stop because there's portions of my body where like I cannot handle any hands-on input. I don't have any pain, I don't have any problems. It's just going to take a while for me to ever get back to the point of someone working on my quads or working on my glutes.
Yeah.
Ever. Like if I went to that point, it would be a long process. Like I'm off the table, naked out the door. I'm like, see,
yeah,
no way. Don't even come near those quads. It hurts, man. So
yeah.
Anyway.
And you say you're not flexible, but like we all know overhead squatting is a pretty good expression of your ability to get in good position. And like, what's your max snatch?
Not a lot, 210, but
like you can put over 200 pounds over your head.
Yeah.
Right?
Oh yeah. I mean, so I'm very flexible to my sport specific, but like to lay back and like do ROMWOD, I look like a dying duck.
Yeah, but who cares? Do you want to be good at ROMWOD?
Exactly. That's where I was, right? People are like, oh, you know, I can't pigeon. And I'm like, dude, I can't pigeon, but I can gymnastic squat hands together overhead, right. Like with a barbell, like, and just, it's fine. Right. Like I can do that. My hips are mobile enough to do everything in this sport. My shoulders are mobile enough to do everything in this sport. And I'm fine. Right.
Yeah. That's a cool idea too. Cause even with like being mobile enough or being strong enough is like a big thing for this sport, right? Like you don't have to be the strongest, but you can't be the weakest.
Right.
Yeah. Like you have to be strong enough for the sport.
Cool. But yeah, I agree. I mean, and you know, I think I made a post, I think it was yesterday, that was that said like you're probably mobile enough. Like you probably have enough mobility. And most of us do, right? It might not be as good as we need it or as good as we want it to be, but it's probably enough. And if we just do the thing, whatever it is, snatching, squatting, swinging on the rings, that is probably going to be enough to make us get better at those things and increase the mobility that we need to accomplish those movements instead of like hanging with a barbell with a foam roller on your back and like forcing your joint to end range for 5 minutes at a time.
Right.
It's a lot of stress on the joints. That shit's tough.
Yeah, you get better at squatting by squatting. Get better at doing handstands by doing handstands, right? It's not like all the other stuff.
This should be such a relief to so many people too hearing this, because how long does all this shit take? Like,
oh yeah,
freaking time consuming.
I mean, I would hope so. That's kind of the goal. I had someone comment on one of my posts the other day. I said, a good coach isn't justified by like their credentials, basically, or vice versa. And he said, he's like, nothing you say is empowering, and it's always sounds like you're calling someone out. I'm like, I feel like everything I try and say is like just opening the mindset of we need a lot less and we're a lot more capable as our own selves, right? Like the better I do, the less patience I have, the more influential I can be via, you know, just like people looking in, right?
Right.
And that's the goal, right? Terrible business model, by the way. I never said that. You gotta hustle way harder to get more people, because you know you want to get to a point where, like, you know, PT's always asking me like, how many people are on your caseload? I'm like, I don't know, not a lot. I don't want a caseload. That's not not the point of this. Like, you know, I want to just see people and help them get better. right? Like, I don't want to watch someone run through exercises. That's not a great way to treat. I think that's absurd. And I think that's why I like this situation. What I can do is everyone that comes in is, I know they're going to do their exercises. I want to see them again. I want to go over what we went over the first time. Then we want to progress or regress if we need to, or go back through and start over, whatever it is at that point. But I don't need to watch them do, I don't know, single arm, half kneeling presses.
Right.
So speaking of things that impair recovery, whether that's, well, for this one in particular, I believe it's more so injury than recovery from training. But so I think you did a post on this maybe a few weeks ago, a couple months ago, rice. I think this is, I thought that this was something that was kind of starting to get out to the general public, because it's not really new news, right? I mean, and we'll kind of get into the background on this in a minute, but the guy who came out with rice originally, which is basically, in short, the idea that post-injury you should ice your injury to improve healing, essentially. So the guy came out and said I was fucking wrong, is basically what he said a couple of years ago, I believe. And I thought this was starting to get out to people, but I've realized that it's not. So I think this is totally something worth you kind of breaking this down and explaining to people kind of the how and why this is not the best practice.
Yeah. This was like the one, I would say probably one of the only evidentially supported things that's ever come out of K-Star's mouth. That wasn't his own opinion. He actually had a lot of evidence that supports his notions, and this is where I kind of initially got it from. But basically the concept of RICE, which is rest, ice, compression, elevation, post-injury, usually it's like an ankle sprain or something, is that we need time for the tissue to heal, which is correct. Ice will prevent inflammation, which is sort of correct. Compression, which is still very accurate, and elevation, which is still very accurate. But the rest and ice part, the issues with it is complete rest reduces our ability to just function as a human. We start getting hormonal changes and we start being depressed. Most people who get injured, that have traumatic injuries, are very active. That's a very blanket statement, so it's not obviously 100% true, but they like moving. So if you're not doing something you like and you're just kind of like, nah, and you're just like a fucking mashed potato in front of Netflix watching Witcher, by the way, which is an awesome series. It was really good. So it makes you sad, and then it prevents our ability to produce, endorphins and positive hormones that will improve our ability to regenerate tissue. Now, on the other side of that, we have ice, and ice does a good job at relieving pain, right? It doesn't really do a good job of anything else. That's it. That's all it's for. And inflammation is literally in the concepts and stages of tissue healing. It's the first one. The first one. It's the first thing that happens for us to heal tissue. So if we fuck with it, it's a bad thing. All right? It's just not smart. Okay? But why? Why would we want to mess with something that's been happening in our body since we stood upright? Right? I mean, since forever. It's just part of the body. Our medical ingenuity that has been established over the last 70 years, we'll say 1950 is when we really started like making strides in medicine. The knowledge we have over 70 years is not more vast or more accomplished than our biological ancestors and what we've learned and what our bodies adapted to over thousands and thousands and thousands of years. So inflammation is normal, it's expected, and it's part of it. Now we can have super excessive inflammation. That's not good. So how do we prevent that? It's kind of tough. We protect it and we wrap it. We can compress it, and we just give it time. And on the other side of that, right, what does everyone say? To help healing, right? For some reason, people have always thought that NSAIDs or ibuprofen and Aleve and Tylenol like actually heal anything. For some reason. That like it's a drug that makes you better, like a beta blocker or like something like a cardiovascular drug, right? Like it's or something that's going to help improve, liver enzymes, right? Like, I mean, like that's not what it is. It is literally a blocker. It's a pain blocker and an anti-inflammatory. Now, what it does is it prevents our body from producing COX-1 and COX-2 chemicals, right? So basically what that means is those things are what produce our prostaglandins, which is what is the inflammation, which is sent to the area to start regenerating tissue. And when we prevent that, and we prevent the same thing kind of as ice, right? So we don't want to take NSAIDs either. We want to avoid NSAIDs, avoid them at all costs. Even if it feels better, it's not worth it. When we start messing with tissue healing and those things, it's not good, right? So when we get injured, it's going to take X amount of time. Tissue takes however long to heal, right? Anywhere from 6 to 12 weeks, most of the time, somewhere in there, right? So it's going to take time. Okay. During that time, we do things, we make smart decisions. We move, we stay very active as we can without causing lots of pain. And we let the body do its job, right? We try not to interfere with it too much. Yeah. But everyone wants it faster, right? It's the American way, whatever, Western way. Sorry, guys. It is though, bigger, faster. And it's like, well, that's unfortunately not how it works. We've never been able to actually increase tissue healing times.
Yeah. One of my biggest frustrations when so just using the elbow example I used earlier, if somebody has a sore elbow, some sort of pain response in the elbow, so then they just take a week off of the gym. And this is somebody who regularly comes, and the unfortunate part is that the language that they've been communicated with at their healthcare professional is what's causing that to happen, right? Yeah. Like they go to whoever and say, "Hey, my elbow hurts," and they're like, "Oh, just take a week, take it easy for a week," and then it's perceived as like, "Don't do anything for a week," when 95% of their body is working completely fine.
Completely fine.
Yeah, I don't know. It comes up all the time. And then it circles back to like, I'm going to do nothing, but I want you to give me stretches for the one part of my body that hurts. And I'm like, what is going on here?
That's it. We were taught that in school. It's not their fault.
No.
They don't know. And that's the shitty part, right? We as providers, even coaches, right? It's fortunately up to us to give appropriate knowledge, right? And that's why language and what you say is very, very important. It's the most important thing that we can do. Mm-hmm. There's no perfect intervention. There's no perfect treatment, but there is the right and wrong things to say to a patient that is in pain. And that's really, really important to understand, because we can set them up for success, or we can set them up for a life full of fear because they have flat feet.
Right. Exactly. Yeah.
And you guys have seen me move, but I am literally reincarnated French Flintstone. But I don't have any fucking knee pain or hip pain. So I never have. I go through like bouts of like tendonitis from squatting a ton or throwing a D-ball around. But that's just part of training. I know it goes away every time. Right? Everyone that's listening, even if you're in pain, you've had other pains before. You're probably batting 1,000 for being in pain and the pain going away, right? And whether that was because you had an intervention and it went away, good. I'm glad the intervention worked. It probably wasn't the only thing that made it go away. Old natural history, body processes, things like that. Just regression from the mean. We have this peak pain response. 6 weeks later, we feel better. Why? Because the body's supposed to do that. Not because you got rolfed or I don't know, dry needled, or you saw a massage therapist. Those things help for sure. They can, right? Why? Again, the reasonings why much different than we thought, right? A lot of perception and subjective inputs and beliefs and things like that. So it's really important to understand what's going on and why, and why things are working the way they are. So
I feel like if there's one message that people can take away from our talk today is that the body wants to heal, because I think regardless of what they're told by a practitioner or whoever, like having an injury, especially if you're someone who's used to going balls to the wall, more often than not, it's easy to slip into that kind of all or none mindset. Mm-hmm. And you think, son of a bitch, like I hurt my shoulder, can't do what I normally can't do what I want to do. I'm just going to sit at home all week and wait till this heals up. Whether or not that's what they want to do or not, I get how people kind of sink into that rut. I mean, that's what it is you just kind of, whatever, you beat yourself up, you feel low. And so I think that's a good thing to just keep in mind, is that, you know what, everyone's been there before. Your body wants to heal. So just get back in
Let
there.
it.
Really.
Yeah. Just let it do.
Yeah. Let it do its job.
Yeah, I think. Let's just jump into the next one. I got some rapid fire. I want to get some more out of you before, so that we don't keep you too long. Another situation from the gym. Somebody comes back from a PT or whatever. They need to take a break from deadlifting because they have a weak core.
Sure. 100%. Sure.
Yeah.
All right. So they have back pain when deadlifting, and the response, the reasoning is because they have a weak core.
Yes.
Right?
Yep.
Okay. Of all of them, that's just not accurate whatsoever. Like, there's just no way that was ever potentially possible. Now, could they move terrible and like their pattern, like because they're in pain, or like the whole chicken or the egg argument, like the way they're moving is causing pain. The way you move can for sure cause pain, right? We're never saying that they're, but that doesn't mean that specific movement is bad. It's bad for you at that point in time. Okay. And especially for the whole back pain and weak core thing, there's a lot of good evidence that actually shows increased EMG activity for people that have a lot of back pain, meaning their core is working way harder and working more and putting out more force than someone who's not in pain. So
the opposite.
Probably not. Right. Yeah, exactly.
Yeah.
A lot of the time. Go ahead.
Maybe not that they have a strong core, but that they have their core is overcompensating when they're doing things.
It could be a little spastic because of pain, right? I mean, that's very common. But I mean, we look at it again as tolerance, right? But it's probably not. If they're in a CrossFit gym, they don't have a weak core. You get to say you have a weak core when you're wheelchair bound and you fall over in your wheelchair and you literally can't pick yourself back up. Like, you just fold over in the chair and you're stuck. Yeah. Then you can say you have a weak core. And I've seen that. And you want to know what causes that? Neurological deficits, like vast neurological traumas. Not someone who can't hollow hold. That has shit to do with your.
It's wild to me. Well, I understand, but the language, like, people attach themselves to it, and then that's who they are now for the rest of their life. And I could come across them 15 years later, and they're like, "Oh, I have a bad back," and I'm like, "Oh, when did that start?" "Oh, I went tobogganing." "Oh, that was super Canadian. Sorry."
Tobogganing.
That was so Canadian. It was unbelievable.
You made my whole day. Perfect.
Went tobogganing, hit some ice, and hurt my back when I was 15, and this person's 55 when they see me. I'm like, well, okay.
Right.
You're good.
Yeah.
You don't have a bad back.
But so on that note, right, so then why do they keep having recurring pain? Again, This is a great example of why pain is not directly related to tissue damage. We know it heals. But we also know that once we're in pain, it's much easier to get back in pain in that same spot because the body remembers. And it will, so you have all of these reasons why you may be in pain, from life stressors to actual, physical exertion to injury. The body will always revert back to what it knows best, and it remembers how to be in pain, right? Or it will go into this full panic mode with this certain region because it's been in pain before. So it's like, oh shit, I remember this. This is happening again. I have to protect myself. So that's what chronic pain is. That's why people in chronic pain are there, because their body feels threatened all of the time.
All right. Couple minutes left, so a few more rapid fire. But what do you think about, I feel like an idiot even asking this, what do you think about kids lifting weights? I don't even know what the argument is here.
I think it's super, yeah, I know, right? I think it's super, well, the argument is growth plate, stunting, and which doesn't make any sense whatsoever. But no, kids lifting weights I think is super important. I think that understanding intensity and volume is very important as someone, but more so just because they're beginners, not because of their age. Yeah. I think play is much more important than actually lifting weights at that age. Allowing kids to play and jump and lift weights based on how they feel and just what they want to do for that time. If the kid really wants to push it, you know, as long as they're under supervision and you let them go. I mean, they're the same risk of injury as anyone else, probably actually less. They're very malleable and flexy, and they're all just basically Gumby with bones. So I think it's totally fine and safe.
Yeah. And the forces that they'll get acting on their body when they're playing is probably way more than they would get weightlifting
totally.
or anything like that too.
For sure.
Yeah.
100%.
Or when they're tobogganing.
He's like, CJ can't even believe that's a word. He's like, what the fuck?
Man, I thought it was just like in movies. Yeah, right?
Yeah. It's a crazy word. I got some, just so that our listeners to get to know you a little bit better. What's your favorite CrossFit workout?
I don't know. My favorite CrossFit workout.
Yeah.
Oh, man. Probably 20.1.
Yeah.
Yeah. It's just like, I don't know, pain, a lot of pain. It's just what it was. Just something you can push on, and you know, it was, I don't know, I loved it. It was probably one of my favorite workouts I've ever done. And obviously I did very well at it. So that's why.
Yeah, you sure did. Yeah. You smashed it.
It's not like I like 20.5, which I do like 20.5, and I would like to do that again and not suck at it like I did. So, so it's relative, but 20.1 actually was probably one of my favorite. Yeah.
Yeah. For me, this is always something that is interesting. I just like to know why do you do what you do? Like what made you go down this path? And then maybe it changed since then, I guess. But at this point where you're at, like, why are you doing what you're doing?
So we went through a bunch of, I think like a lot of soul searching, because I basically run two businesses. I run part of WODPrep with Ben, and then I run the Movement Doctor. And sometimes they conflict on priorities and time management and things like that. And so I'm trying to figure out what my overall goal is. And my overall goal is to influence and affect the most people positively, right? And whatever that means, whether that's treating them in person, programming for them for performance, giving them knowledge for rehab to empower them. But it's basically to empower every person that I come in contact with, and as many people as I can over however long I have to do this. So,
right.
Cool. Yeah.
What's next for you?
Working on a couple courses with WODPrep. We have an engine course coming out. Selfless plug. Which we'll be shooting soon. I have a training through pain course, a pain management kind of course of basically teaching people kind of the basics of like how to modify training based on your pain responses and what your injuries are, for kind of a little bit of self-management. So hopefully that's coming out at sometime this year. Hopefully the clinic is growing, hiring a therapist at some point this year, potentially here in Pensacola, but that's it, trying to grow the one-on-one. And we have a one-on-one team, one-on-one coaches here at WODPrep, 4 coaches with a PT. We're trying to grow their rosters and give them opportunity and just, again, continue affecting the most people.
Yeah, we got one client right here. This guy.
Yeah, that's right.
Yeah, Doc Mills.
Yeah.
Yeah. so wild. It was on his story one day, and I was like a snatch, I think, or a clean and jerk. And I was like, I know that gym. And I was like, does he go to London? He was like, yeah. I'm like, that's so weird. I'm like, how much of a small world is that?
Man, that guy gets more shout-outs on our podcast than anyone, I swear.
Oh, yeah. Yeah.
You're welcome.
That's cool. That's good stuff, man. What about you guys? What's next for the experience?
Right now we're pushing out a Thrive program. We're going to actually be announcing the 5 winners at the end of this episode.
Yeah.
Going to get some people sampling that program for us, get some good feedback before we do the full launch. Our goal for this season of the podcast is just to have more guests like yourself, so that we can learn from our guests. Up until this point, our podcast has really been us trying to share our knowledge. And now we kind of want to take a turn to like have our audience learn from healthcare professionals that we trust ourselves and like let them tell their story. Because you provide online services and I mean, although you're in Florida, it doesn't matter now, right? So we want to be able to push our listeners to you. If somebody's experiencing pain and they listen and they like your approach, then we want to get them to you.
Yeah.
It's kind of the whole idea.
Yeah, I think we kind of had a bit of a realization lately too, is that we have very similar goal to what you just said, is that the ultimate goal is to help as many people as possible. And I think to do that, like you just said, get people like you on the show, hopefully put out more of these programs like this to target people who may not have access to them already, may not have access to, credible programs to reach their health and fitness goals. And yeah.
Cool. How's the Functional Fitness Federation?
It's good, man. First seminars this Saturday. I'll Zoom you in if you want. It's it starts at 1 p.m. Eastern.
Okay. I'll probably be in the car. I might be able to send me the link. I'll see if I can hop.
All right.
I'd be in the car, so I might be able to watch. Going to grandma's house for lunch.
Yeah. So where we're at right now with it, like this week, I got the Ontario Functional Fitness Sports Association Incorporated, did the whole not-for-profit thing. So all the paperwork's done. So we're good to go from that side. Talking to a company from Vancouver called 2M about getting the back end set up so that we can set up like the actual club memberships and the individual athlete memberships. And then it's going to I'm going to have to shift gears to focusing on the World Championship qualifier that we're hosting at Westland and CrossFit in June. That's going to take up a lot of time for a few months, and then I'll get back into trying to.
So do you program that? How does that work?
I don't program it. No, there's a programming board. So do you know, do you know Mike Fitzgerald? He's the head of that board. And then there's, I think 3 or 4 other people that have input as well as to the programming. Then it has to get sent off to the International Federation to get approved.
Gotcha.
So
cool.
Yeah.
Awesome. Well, cool, man. Well, good luck with that. That sounds fun.
Thanks, man. Where can people find you?
Instagram.com/the_movement_doctor. Just search the movement doctor. There's a few fakes on there, but I'm first. No, you'd be surprised how many people try to have how many people follow me with different iterations of the movement doctor. Like 15.
That follow you, your movement doctor account.
Yeah. I'm like, it's so, after the first couple, I was just like, I said something to a few people that were students, and then I just didn't care anymore. I was like,
Yeah.
Copywriting super and trademarking is really, really expensive. So we're not there yet. Maybe one day. So Instagram, obviously Facebook, The Movement Doctor, and then my website's themovementdoctor.net. But pretty much everything is on social, Instagram and Facebook. And then I think I have a YouTube channel, but I just put exercise examples on there for True Coach. Really. Right.
Yeah. Yeah, and if you follow WODPrep at all, you're going to see CJ in all the Facebook groups giving coaching and things like that.
Yep, everything WODPrep. So I think that's it.
Sweet.
All the things.
I'll probably see you doing a overhead squat demo tonight when I get to the gym.
Probably.
On True Coach.
On True Coach, that's right. Yeah. Cool, man. Well, yeah. Well, thanks for having me on, guys.
Hey, thanks for joining us. We really appreciate you taking time out of your day.
Yeah, for sure.
Awesome.
Sweet. Where are you going now?
Right now?
Yeah.
Oh, I'm going to train. Got to go for WODPalooza, man.
Oh, yeah. What's that?
Yeah.
End of this month? Or end of February, sorry?
February 23rd, that weekend.
Cool.
Yeah, so we qualified a team, and then I have 4 athletes competing.
Nice.
And it's WODPrep Business World Summit. So way too overbooked, probably going to bomb and flame out, but it's going to be a lot of fun. It'll be fun. It's cool. So yeah, we have a team, RX, so we're excited.
Nice.
Good.
That'd be cool,
Yeah,
man.
Yeah, I'm bummed I can't make it down this year, but it's a bit of a hike from London, Ontario to get down there. So
it's a bit of a hike from Pensacola, man. It's 700 miles. It's not close, even though we're in the same city. It's super far. It's an 11-hour car ride. So it's far.
Yeah.
We don't ever understand that, but it's far.
Yeah.
It's like coast to coast in California, top to bottom, legit, whole thing. How far it is.
That's wow. I did not. I
Shit.
thought it's like I don't know.
Couple
Super
hours,
ignorant.
no.
I think Florida, it's like 2 hours to everything.
And when we went to London, I was like, I have no idea. It took me like 5 minutes to find out. And I'm like, where the fuck are we? But you don't know what you don't know, right?
Yeah.
Yeah.
Anyhow, all right, guys.
Okay.
Cool. Thanks, man.
Thanks, man. Have fun training.
Yep. We'll talk soon.
Yeah, you
See
bet.
ya.
See ya. You
See ya.
bet. See ya. You
See ya.
bet. See ya. You
See ya.
bet. See ya.